Hi everyone. I'm Professor Geoff Morgan from the School of Public Health at University of Sydney and a Chief Investigator with the Centre for Safe Air, and I'll be chairing today's webinar. I'd firstly like to acknowledge the participants on this virtual meeting today are on the traditional lands of First Nations people throughout Australia. I'm based at the University of Sydney's Lismore campus in northern New South Wales, that stands on the country of the Widjabul-Waiable peoples of the Bundjalung Nation. And I'd like to pay my respects to First Nations elders past, present and emerging, including their knowledge of the relation between their country, the environment and health, gained over many thousands of years. So welcome everyone to this meeting, and welcome to all First Nations peoples here today. The transport sector contributes nearly a fifth of Australia's air pollution. Creating safer air for all Australians means thinking about transport fuels and their emissions, who's most at risk, and settings or locations where people are exposed to transport-related air pollution. Today, we've got two speakers who will present some of their work in this area. Dr. Tim Chaston and Keith Loveridge. Each speaker will present for up to 20 minutes, followed by a Q&A at the end. Our first speaker today is Tim Chaston. Tim has worked in biomedical, clinical and epidemiological research and has extensive experience in the publication industry. Currently, Tim works at EPA Victoria, where he's establishing a health tracking network to inform and improve regulatory activities relating to pollution and waste, and to measure the impacts associated with human health and well-being of those hazards. Tim's presentation today will describe his research on the health impacts of traffic-related air pollution, including both recently published and unpublished work. Thanks, Tim.
Thanks, Geoff, and thanks, Bill and Sabrina, for inviting me to speak today. I'm really excited about that. I'll just share my slides. So I'm going to talk about two studies today, two pretty related studies on traffic-related air pollution. The first one is a comparison of counterfactual and baseline scenarios. And in this case, the counterfactual is indeed a reduction in air pollution that didn't happen, although it reflects the changes that did happen, the lived changes or experience of April 2020 during the COVID-19 pandemic. I should mention that these studies are important to EPA Victoria as a regulator of pollution and waste because they point to the co-benefits, I suppose, of changes in fossil fuel use and the transition to carbon-free economy. So in the first study, as I mentioned, it's a model of COVID-19 associated changes. I should mention ambient nitrogen dioxide is the key pollutant in both of these studies, and that's because it's strongly associated with tailpipe emissions in motor vehicles, and with all internal combustion engines actually, and that's got something to do with the chemistry of internal combustion. We all recall the behavioural interventions that led to the changes in traffic volumes, and we were able to estimate how much change in nitrogen dioxide happened as a consequence. Nitrogen dioxide, from an epidemiological perspective, is representative of actually a range of pollutants. but it's the gas that's monitored by standard air pollution monitors. So we modelled the associated mortality benefits, although I shouldn't mince my terms here. We modelled the difference in mortality burden, assuming those reductions from the COVID-19 pandemic were sustained for several decades. We used a satellite and geospatial regression model to determine or estimate population-weighted average exposures, and we've listed them here. And you can see that they really do reflect the size of the city and possibly its density too. The highest population-weighted exposures to NO2 and the mixture of pollutants were in Melbourne and Sydney, the two biggest cities. We used satellite aerosol optical depth to compare the April 2020 with the preceding Aprils, and we show that, or we estimate that there was a 29% reduction in NO2 concentrations in Melbourne, a 21% reduction in Sydney, and varying reductions across Australian cities, actually, which is quite an interesting point to make. This resulted in April 2020 NO2 concentrations quite a bit lower, not half, but quite a bit lower than those determined using the regression model of NO2. Here we show in the fluoropleth maps that difference. These are mesh blocks. Mesh blocks are the smallest ABS statistical area, and we have an NO2 concentration estimate for each of those mesh blocks in Australia. And you can see here that the biggest reduction was really in Melbourne and in Canberra, and somewhat in Sydney, a little bit in Brisbane, you can see, but in Adelaide and Perth, you really don't see much of a change in NO2 concentration deciles. Just briefly, the health burden analysis is a pretty standard tool. We've used the relative risk value of 1.023, which is recommended by the World Health Organization, and is really scrutinized in great detail by the Committee on Medical Effects of Air Pollution in their publication of 2018. And the value is based on a meta-analysis of many really large epidemiological studies. The attributable fraction method is fairly simple. Basically, we're using that value, 1.023, to portion the all deaths to attribute a small portion of all deaths to NO2 exposure. And then if we know how many deaths there were, we can very easily calculate the attributable number of deaths annually. So the attributable fraction of deaths, we've expressed that per 1,000 deaths here. We attribute 11.5 annually to NO2 in Melbourne, 12.9 in Sydney, a little more. And if you look at the scenario of COVID-19 restrictions, if that had been sustained for decades, then we would attribute quite a few less deaths to NO2 exposures. I love including this slide because it really shows us what's in the black box of a years of life lost calculation. The small orange tips of each of the bars represent the portion of deaths or the attributable deaths. And we have these in age groups. So I've got deaths in age groups expressed per 1,000 people. And clearly, older age groups, there are more deaths per 1,000 people. Given knowledge of life expectancy, you can then calculate in each of those age groups how many years of life were lost with each of those premature deaths. And then you can sum them over age groups and you get an estimate of years of life lost. attributable to the pollutant. And so we estimate 3,870 years of life are lost due to NO2 in Melbourne, more in Sydney, and quite a bit less in places like Canberra and where there isn't as much air pollution. Interestingly, there's quite a big difference in years of life lost when you compare the counterfactual scenario of sustained lockdown conditions. So I'm going to move on to the second study, which is we're really turning the counterfactual and baseline scenarios, we're switching them. And in this study, the counterfactual scenario is, so the scenario that didn't happen is one where there was no change in nitrogen dioxide concentrations over time. And so the baseline was in fact a change. And so that's the first observation, really, and that is that NO2 concentrations really did have decreased year on year since, well, at least since 2005. That's the first year that we have the satellite and spatial predictor model from Nibs et al. And you can see here the difference between 2005 and 2022. It's quite a noticeable change. It's also noticeable that NO2 really is very much associated with roads and therefore traffic. We can see that change also in the year-on-year change in air pollution models and at regulatory monitors. So here I've graphed the SA2, so statistical area 2, year-on-year changes from the models, and also those changes at the corresponding air pollution monitors in those areas. So that's a real, really indicates that there has actually been a change over time. One of the shortcomings of the COVID-19 study was that we really didn't have a device for portioning total NO2 exposures by traffic and non-traffic. So in this study, we got our hands on a chemical transport model that was based on emissions inventory from 2016 in Victoria. And with this model, we can portion in space the NO2 that can be associated with traffic and that's associated with other things like industry emissions and even bushfires and other combustion. And you can see here on the left is all NO2 and on the right is NO2 with no vehicles. And we know that to the west of Melbourne there's a lot of industry that produces a lot of air pollution. So we used a similar or exactly the same method. This time we used a scientific workflow system that was developed University of Sydney and Curtin University and is available for people to use via CARDAT. Again, we used the relative risk of 1.023 and we do the calculation on SA2 populations with population weighted average concentrations. We've then gone a step further because the mortality burden gives us a comparison of if this situation with air pollution over many years, this is how many deaths you could attribute or years of life lost you could attribute versus the other situation or the counterfactual. And that's a mortality burden, but it really assumes that the population has been exposed for a couple of decades. But we know that if you have a year-on-year change in air pollution, there are health benefits, but they're really lagged. There's a lag over the course of about 20 years. So and also the change in air pollution itself, is incremental. and not necessarily uniform year on year. So we've used a Leslie matrix table. So this is a model of survival in 1 year age groups and calendar years. So that the age groups and the calendar years are separate dimensions in a matrix. And this allows you to enter these year-on-year parameters of so the lag in health and also the year-on-year gradual change in NO2 concentrations. And I forgot to mention that the change in NO2 concentrations since 2005 are largely to do with tailpipe emissions standards that were legislated in 2005 and then more stringently in 2013. So this is quite a positive story because it indicates, well, it encourages society really to consider these kinds of interventions in air pollution interventions. So in 2005, so we again use an average from a number of years. So the average concentration in Melbourne for the average Melbourne person in the years 2005 to 2008 was 20 micrograms per cubic metre. Much less in outside of Melbourne, so the regional average is about 6.4. We use a cutoff of 5 micrograms per cubic metre, mainly because the epidemiology doesn't support a health effect below that concentration. But there are other reasons too. There is a certain amount of natural NO2 in the environment from composting and various other natural processes. And so using our chemical transport model, we estimate that only 2.4 micrograms per cubic metre, the average population-weighted average exposure to NO2 with no motor vehicles at all during 2005 to 2008 would have only been about 2.4 micrograms per cubic metre. And the last column shows just how the proportion that can be attributed to motor vehicles, proportion of NO2, it really is very different in the city compared to in the regions. So only 20% in regions, but 63% across all of Melbourne. And I should note that varies within Melbourne too. Much closer to the city, you're talking about more like 98% is due to vehicles. So the burden, we estimate that about 13,000 years of life lost can be attributed to, or could have been attributed to NO2 exposures at the 2005 to 2008 level. So that's prior to any intervention, and 12,000 of those are in the city. And if there were no motor vehicles, clearly you can see in the second column, those values are much, much less. But then we move on to the impact, and we estimate that since 2005, so not even counting what happens next, with no further intervention, we estimate that almost 12,000 years of life have already been gained, and more than 10,000 of those in Melbourne. You can see in the graph to the bottom right, the pale blue dotted line represents the years of life gained each year if there was no lag in health effect. And then the darker blue line shows what happens if you do introduce that lag. And then the red line shows what happens with the lag and with the gradual year-on-year changes in NO2. So not much benefit for the first probably 10 years, really. But then if you run this model out to the end of the lives of all the people alive during that change, then and add them all up, you get more like 400,000 years of life gained for the people, and that's assuming no further changes, no further improvements in traffic-related air pollution. Finally, we expressed the years of life gained per 1,000 people, just to see, and did the calculation in statistical area 4, so big regional areas of Victoria. I think there are 10 or so of them in Melbourne, and we see that there really are differences across the city. In Melbourne's west, the benefit per capita is not much different to the benefit in the regions, where we already know that there's not much of an issue with tailpipe emissions. And interestingly, the greatest benefit is on the Mornington Peninsula, and we believe that that is associated with the very high proportion of people over the age of 65. So they have more deaths. But also there's some vehicle dependency out there, and very little in the way of industries generating NO2. So we conclude that mobility restrictions, if they could be sustained, and perhaps in future there may be interventions that lead to similar kinds of reductions in traffic-related air pollution, and that there's a considerable health benefit of that, or there would be, and that's represented by 3,384 less years of life lost as a burden across Australia. And then the impact of the actual traffic emissions control since 2005 is greater than 10,000 years of life lost, and those impacts are greatest for older metropolitan populations that are not exposed to industry emissions. So thanks very much. I'd like to just acknowledge Curtin University and the University of Sydney for developing the tools that are used here, and also many of the data sets. Centre for Safe Air, obviously. I work at EPA Victoria, and I'm proud to be a part of the Healthy Environments and Lives network. Thanks very much. I look forward to any questions.
So thanks so much, Tim, for that presentation. That was great. I'd encourage people to think about their questions, and you can type them into the Q&A link on the ribbon at the bottom of the Zoom screen. But we're going to keep questions until after our final speaker, Keith Loveridge, who I'll introduce now. So thanks, Tim, but we'll come back to you in a moment. So Keith, our next speaker, is a former senior sustainability officer with the City of Maribyrnong and a lecturer and tutor at the Royal Melbourne Institute of Technology, RMIT, whose work has included engaging with citizen scientists and advocates on reducing transport emissions in Melbourne. Keith's got a long history of working in the environmental sustainability sector in local government, including air quality. In collaboration with the community, Keith developed Maribyrnong Council's Air Quality Improvement Plan. And he was a committee member of the Victorian government-funded Inner West Air Quality Community Reference Group for 2 years, who worked on improving the poor air quality in the inner western suburbs of Melbourne. He's also a member of the Maribyrnong Truck Action Group, working to improve the poor air quality caused by trucks in the western suburbs of Melbourne. Keith will talk to us today about his involvement in an ABC story on why Melbourne's Southern Cross Station may have some of the least clean air in the city. Thanks, Keith.
Lovely. Thank you, Jeff, for the introduction, and good afternoon, everybody. And thank you to the Centre for Safe Air for inviting me to talk about Southern Cross Station. It's been around for 17, 18 years now with a roof on it. So there's a lot to talk about, Southern Cross Station, and also the diesel emissions that are causing big problems with staff and passengers. So I've got about 20 minutes, I think, to squeeze in 30 years of eye-openers and science and surprise about the dangers associated with diesel. not only at Southern Cross, but diesel pollution in general. Here's the Channel 7 actually got in touch with me and wanted to do an interview. And so I'll just play this little report from the Channel 7 News back in March.
Southern Cross Station has been exposed for its poor air quality. Paul Dowsley has the latest this evening, and Paul, some of the results are alarming.
Mitch, nitrogen dioxide levels in parts of the station have regularly exceeded 90 times the levels recommended by the World Health Organisation. Leading respiratory experts say the pollution puts human health at risk, and that it's probably some of Melbourne's dirtiest air, particularly in the bus terminal, where it's often more than 3 times the EPA's extremely poor threshold. These disturbing results were exposed through Freedom of Information after an environmental scientist raised concerns.
Throw it all in together and you've got a toxic soup in that building. They're hiding it because they know how bad it is. But, you know, when it's people's lives at risk, you can't do that. You've actually got to fix it.
The private operator of Southern Cross Station says the emissions here are within the limits from Safe Work Australia, and that, Mitch, they are doing what they can to make that even lower.
Paul Dowsley at Southern Cross Station, thank you.
So, yeah, I get a bit worked up about that sort of stuff. But anyway, when I first went to Southern Cross Station, I was living in Croydon, and I had to catch a train across to the other side of the city, and I had to change at Southern Cross Station. And the first time I got out of the train, I couldn't believe how bad the diesel fumes were in the station. And I've taken lots of photos, but there's a couple of photos here that I took while I was wandering around the station. And over the time that I was going in and out of the station, I actually spoke to a lot of station staff and asked them questions about how did you feel about, you know, all the diesel fumes. Well, it actually opened up a whole new world about indoor air quality for me. Although at the time I didn't realize that it was classed as an indoor environment, but that came later. And it was interesting because I found out lots of information about, you know, when it was built and why it was built and how it was built. And this is what the company that actually designed the station, this is what they said about the roof. The structure of the roof was developed to assist with the extraction of diesel fumes, so they recognize that, and other air contaminants through natural ventilation systems, which was like open windows at the very top. While the northwest and southwest winds are essential to the operation of the ventilation system, in other words, they had to get northerlies and southerlies blowing in order to clear a lot of that air, and that's what they relied on. But, you know, my thinking at the time was, you know, what happens when there's no wind blowing? Where does the smoke go? Where does the diesel fumes go? And, you know, I found that out a bit later on when I did a bit of testing. So the bottom line in all this, there is no safe threshold for exposure to diesel exhaust. You know, we measure NO2, nitrogen dioxide, and a few other things out of diesel, but we never measure PM1 or ultrafines. PM1 and ultrafine, they're the major things that come out of diesel exhaust, and we don't have any standards for them. So it's not recognized, unfortunately. It's recognized that there are major problems, health problems with them, but it's just not recognized that we don't do any monitoring of them. So the state environment planning policy for air quality management in Victoria has been recognized as outdated and not fully protective of public health. This was a report from a couple of years ago. The standards have not kept pace with recent scientific understanding of air pollution and its health impacts. That was remarks that was put out by Claire Walter and Professor Lou Irving from the lung section at Melbourne Hospital. And they talked about, they had a discussion paper, and it's on the internet if you want to have a read of it, examining the future task of Victorian EPA with regards to, you know, air pollution and, you know, what needs to be done about it. So it's really important to understand that. So staff and passenger health issues. So during my investigation at Southern Cross, about staff and talking to staff. This has come up in at the end of August. This gentleman here, elevator mechanic, worked at Southern Cross for about 3 years and said he was covered with diesel fumes and brake dust. And in 2015, a general practitioner found his liver had stopped functioning properly. And an examination last month asserting that his exposure to diesel fumes was likely to blame. So he's now lodged a workers' compensation claim, while the owners of the station say they're investigating potential ventilation improvements. And this is like 17 years after the station was built. So during my time at the station, I actually, speaking to a lot of the people that worked there, they actually gave me the logbooks from the station about where they reported some of the problems that they were having with diesel. You know, Collins Street barriers left unattended due to diesel fumes, smell of diesel fumes coming into the control room, large amounts of diesel exhaust fumes from the sail train arrival on platform 13 and 14. I had so many reports, like from 2007 to 2010, and one of the reports from the station was about passengers getting heart attacks. And at the time, I didn't really. I thought, well, that's that people have heart attacks. That's understandable in different places. But there's now research that's been put out there that says there are some people who are susceptible to heart attacks, and if they're exposed to diesel fumes, PM1, PM2.5, nitrogen dioxide, it can actually trigger a heart attack within an hour of them being exposed to this diesel exhaust. So you've got to be very mindful about there are certain people that can have heart attacks from being exposed to diesel exhaust very quickly. Lots of staff comments about the roof, and one of them was that came to my mind was the union can't do anything because it's a Labor government and they don't want any complaints about the award-winning roof that costs millions. So that's sort of stuff that the workers at the station sent to me. And of course, there's lots of media articles about Southern Cross Station and diesel exhaust, starting from 2006. Under the Southern Cross, the fumes must move. So that was actually just after it opened. So they already recognised that there were problems with the station. 2010, Southern Cross Station fumes are hazard. The opposition, actually Liberal Party, came out and said that there were problems with the station. 2011, so it said Southern Cross Station, we're going to act on diesel fumes. I don't think anything ever happened after that as well. And 2012, headline from the Herald Sun, headaches at Melbourne's Southern Cross Station. Staff call themselves the walking dead after being smothered in diesel fumes. That's really concerning that staff should think that. Anyway, back in 2011, a friend of mine came over from the States, an environmental scientist, and he said to me, anything you want me to do while I'm here on holidays? I said, yeah, let's go to Southern Cross Station and do some monitoring, because we were never given, we were never allowed to look at the monitoring data from the station, and so we went there with a monitor that we hired from an organisation that gave out air monitors, and we walked around the station for about 3 hours with the monitor in a bag with a pipe hanging out, so that we could actually see what the levels were. And the PM2.5 levels that we after 3 hours, the average PM2.5 levels at the station were 28.5 micrograms per cubic meter. And then we walked outside and did some testing outside, and we found it was 14 outside. So it was double what the levels were inside the station. And, there were sometimes there were 6 trains idling, sometimes there were just a couple, but the average over that period of time was 28.5, which was really high. And remember, we're not looking at PM1 or ultrafines. And, you know, they're the ones that are the worst with diesel exhaust. There is no safe level. So after the ABC actually rang me, they must have seen the stories that we were doing about Southern Cross Station, and they rang me and said, oh, we're going to try and get some freedom of information data about Southern Cross Station and the air quality measurements that had been done. And I said, yeah, go for it. And it took them 9 months to actually get the information. But they got 12 years of air pollution data taken at the station. And the station had been exceeding the World Health Organization guidelines for nitrogen dioxide. As Channel 7 stated, the levels were more than 90 times above the World Health Organization guidelines. So, you know, it was a real problem that had never been addressed at the station. And they actually got a V-line document titled Risks Associated with Diesel Exhaust Emissions at Southern Cross Station. Well, they actually didn't get it because it was refused. They refused to give it to them because the department found it wouldn't be in the public interest to release it. Another V-line report called PTV Emissions Report wasn't released because it was deemed contrary to public interest, as the information will misinform the general public on the current state of V-line carbon emissions. So, you know, they held on to a lot of the documents and wouldn't put them out to the ABC. But I also put the ABC in touch with this family who lived across the road from the station, and their story was published the following day. And they lived in a unit 3 stories above the roof of the station. And she actually put in a monitor on her balcony, and they were finding that the levels of PM 2.5 were 100 micrograms per cubic meter. And when you think the World Health Organization standards at the moment, which they just revised in 2021 for PM 2.5, they're around 5 micrograms per cubic meter for annual exposure standard and 15 for 24-hour standard. So, you know, the levels at that unit are just ridiculous. And actually, Catherine, the lady in that photograph, has put out a petition to try to get Southern Cross Station Authority to actually do something about the emissions from the station. A couple of weeks later, 4 professors from Swinburne University of Technology actually wrote an article about it, talking about poor air quality at train stations, such as Melbourne Southern Cross Station, and it underscores a significant public health concern, and it's becoming recognized worldwide. So they wrote this really good article that's still out there on the internet about, particularly about Southern Cross Station. Now, this was the final news article that I've got about Southern Cross Station, 31st of August, that the ABC also wrote. And this was really interesting because it talked about industry super funds own Melbourne Southern Cross Station and why are the workers concerned. So there's union connections with the Melbourne Southern Cross Station, and the Transport Workers Union represents many workers at the station. They have strong links with TWU Super and Super Fund, which is associated with the union. And this connection includes significant financial transfers between the Super Fund and the union. So if you want to read about Southern Cross Station and the union connection, have a look at this article that's still out there. So diesel emissions and health, successive state and federal governments have failed to adequately address the problem and protect communities from harm. This is a photo that was taken in Melbourne with a freight train running through. You can see the pollution coming out of that train, and train lines, as you know, run through areas where there's childcare centres, schools, people, suburban areas living next to railway lines. So, that is a real problem. So diesel emissions from trains, they're not monitored or regulated. despite possible health risks, unfortunately. And as a lot of people would understand, approximately 80 to 95% of diesel particulates are PM1 or ultrafine particulate matter. And so they're really damaging to human health. And hopefully something will start to be done about trains. So diesel, as we all probably understand, diesel engine exhaust has been classified as carcinogenic to humans, a group 1 back in 2012. And so here's some information that during the introduction, Geoff talked about the Inner West Air Quality Community Reference Group report that I was a member of, that we wrote for the Victorian government. The government actually put us together, and there were 3 of us from local government, and the rest were community members. And we spent 2 years investigating and writing this report, and also the Air Quality Improvement Plan that I wrote for Maribyrnong Council talks a lot about all the diesel emissions. And this photo you see here of a train, it's running through Footscray. It's running from Footscray to Tottenham on the Footscray-Tottenham railway line. And you can see the fumes coming out of that train. It's just ridiculous. So, you know, something's got to be done about train lines and fixing that problem. So just quickly, there's this was something when I worked at Maribyrnong Council, I did a lot of planning applications, and I'm standing on the corner of Williamstown Road and Francis Street. And where I'm standing, a VCAT approved the childcare centre. So you can see all the trucks that are going to turn into Francis Street, like affecting that childcare centre. So, you know, the government needs to do a little bit more about diesel exhaust in particular affecting people. Australian workplace standards. The current workplace standard for diesel emissions apply to mine sites only. So the standard diesel particulate matter for elemental carbon is 0.1 milligram per cubic meter, which is really high, as you would understand. And Safe Work Australia are actually starting to change that now. There's going to be an indoor exposure limit. So I wrote to them about 7 years ago about how about getting diesel exhaust standard for indoor work environments. And eventually they'd come out and they said, yes, we're going to have a new workplace exposure limit, 8-hour time-weighted average for elemental carbon. And remember, I told you that the elemental carbon from mine sites was 0.1. Well, it's now 0.01 milligrams per cubic meter for indoor work environments, which is, you know, a little bit better, but I don't know how effective that's going to be, and you know, what the results are going to be. It's going to be interesting because all workplaces will now have an exposure standard for diesel exhaust. So we've got electric vehicles coming out into the system now, and it was really interesting to see these results from about how many more electric vehicles are on the road. So from 2022 to 2023, the levels of electric vehicles on the road increased by 103%, which is fabulous. And petrol-powered vehicles dropped about 1%. But unfortunately, diesel vehicles increased by 1%. So electric vehicles on the road haven't had that much of an effect because diesel vehicles are still going up. Maybe they would have gone up more if electric vehicles hadn't been on the road. But, you know, it's going to be interesting to see what difference that makes. And as I said before, there is just no safe threshold for exposure to diesel exhaust. So we have to remember that. What I'd like to see, federal government introduce PM1 standards for all states. That's so important to get a PM1 standard out there. Electrical power units connected to stationary trains to stop them idling. I suggested that 17 years ago, and we just haven't taken any notice of it, unfortunately. Maybe the electrification of all trains. I know that would be quite expensive, but a lot of diesel trains now are diesel electric, so they come into the suburbs, they can switch over to electrical power instead of the diesel. The federal government revised the 2021, the World Health Organization revised their guidelines for 6 key air pollutants, including PM2.5, and the level is now down to 5 micrograms per cubic meter for annual, and 24-hour average is 15. So the proposed updated Australian standard for 2025 is now 7 micrograms for PM2.5 and 20 for the 24-hour average, which is a lot more than what the World Health Organization are deciding. And of course, my very bottom line is phasing out of diesel fuel, which some European countries are actually doing. So thank you so much. It's for allowing me to present. And I do want to thank again Claire Walter and Professor Lou Irving, the lung specialist, for their valuable contributions to the research and highlighting the problems associated with diesel emissions affecting children, sick and elderly. So thank you to Claire and Lou as well. And thank you so much for allowing me to present.
Thanks very much, Keith. That was great. We've got a few minutes for questions. We've had several questions already for Tim in the Q&A. So we'll take some of those first, and then we'll move back to Keith to ask a few questions. So, Tim, one of the questions was from Ben Ewald, asking when the new exhaust standards were introduced that you looked at in your study, estimates of mortality benefits were done at the time. What would have been the benefits? And have you been able to compare with those to see how your estimates of the trajectory of change in NO2 over time matched what was anticipated?
Oh, thanks for the question. I had no idea actually that they'd done any calculation like that. It'd be a great thing to compare. Obviously, I'll have to find that information. Were you aware of that, Jeff?
No, I think I'd forgotten about that. But look, it's a great comment, and be worthwhile checking in with Ben if we can't find it. So thank you.
Yeah, thanks, Ben.
So the next question was about your COVID assessment, and highlighting that your assessment about COVID was ambient NO2, but introducing the idea of indoor sources of NO2, and that there's potential huge indoor sources of air pollution, and Keith touched on that as well. And during COVID, where people were staying home, that could have been an issue. Were you able to look at that trade-off, Tim?
I wasn't able to look at that trade-off, no, and I'm not sure how you would do it, though I understand that indeed the indoor air pollution just from non-flued gas stoves is really very high, and perhaps people spending more time making cups of tea might have completely offset the benefits of the traffic. I should mention that actually in real terms there were probably no benefits, at least using the tools that we used, because those changes were only sustained for a month or two, and you don't really register a mortality or even a hospitalization benefit in that amount of time, I suppose. Yeah, but that's a really interesting question, and I know that there's a lot of work being done around indoor air pollution. I'd be interested to know what sort of concentrations people are experiencing in their everyday lives, and the benefits, I suppose, of the transition away from fossil fuels in the home too.
Thanks, Tim. Just one more question, then we'll go over to Keith. So there's a question about a particular study looking at in vitro sort of cellular toxicity of PAHs from urban sources. It's a toxicological study and a reference there. And the study concluded that emissions from engines equipped with exhaust particle filters were more toxic, or potentially more toxic, than non-filtered engines. And I suppose that gets at a related question of assessing the health risks, as you've done, Tim, and how to look at the indoor-outdoor trade-offs, and also looking at outdoor air pollution, just focusing on that, about how spatially precise can you get, with these estimates of health impacts or health burden from the spatial distribution of air pollution.
Yeah, we do our best, and I suppose we're limited to the size of the gridded estimates from air pollution models. We're limited even more, I suppose, if you want to just work with data collected at monitors, and it goes to an age-old question about modelling, and how. Well, there's two types of error. There's the exposure misclassification. So you say person over there was exposed to the amount that you measured over here, and then there's the error in actually estimating the amount, or even measuring the amount, for that matter. Just the toxicological study is pretty interesting. I'm not sure why you get more toxicity with a filter, except that if you focused on gases like PAHs, I don't know that filters do anything for gases. You need a fairly advanced kind of filter that has a way of reacting those gases and I don't know, reducing them to a capturable particle. But I don't know what the I'll be interested to read that paper to learn how that works.
Right. Thanks, Tim. So I'd just like to take the sort of chair's prerogative and ask a question of Keith. Keith, you focused on particularly around Southern Cross Station, the concentrations of air pollution experienced in that station, and referenced their exceedance of the outdoor air quality standards, and that was of concern, and talked about workplace standards that are coming in that may be applied in that setting, I assume would be. Do you have any comments about those improvements from the proposed 2026 standards, about how that may impact air quality in indoor settings like Southern Cross Station?
Well, yes. So they're looking at elemental carbon as the standard for indoor air pollution that they're going to introduce. My concern is there's no standards for PM1 or ultrafines. Nobody's actually been looking at that. And the major pollutant coming out of, as I said, the major pollutant coming out of diesel exhaust is ultrafines and PM1. And there's no standard for it. So, it's all very well having NO2 standards, or elemental carbon standards, but that's not really representative of what the problems are with ultrafines and PM1. I know there's a scientist up in Queensland, Lydia Moroska, who one of the world's leading air pollution experts, she's been talking about PM1 and ultrafines. She was actually employed by the federal government 20 years ago, and she did a report on ultrafines and PM1, and nothing ever happened about it. She was saying that more work has to be done about this, and nothing ever happened about it. So, you know, and it's still going. There's still questions being raised about it. But, you know, we've got a standard for elemental carbon of 10 micrograms per cubic meter inside buildings. That's not going to be introduced till 2026. So, you know, well, we hope it's going to, they put it to the WorkSafe, they put it to the federal government because they're the ones that, you know, do the standards, and they put it to them, and they're still waiting for a response, I understand, whether the federal government will approve it. So, you know, it's still really up in the air, so to speak.
And we also had one more question related to the Southern Cross report, Keith, about have the Vic EPA undertaken any specific evaluation of the air quality in the station in relation to any sort of standards?
No. Well, I can answer that question because I've contacted the EPA on a number of occasions about, you know, the problems with the station, and they always referred me back to the Southern Cross Station Authority. I wrote to the authority and said, you know, can you please give me the results of all your testing? Because part of their contract was they have to test every day, do testing every day. And, you know, and the fact that there's no PM 2.5 standards for indoor environments, it's just nitrogen dioxide for indoor environments. It doesn't really, you know, show what the problems with the diesel is. And the Southern Cross Station Authority refused to send me any information about the results of their testing. They said because it was very complex and, you know, complicated, and you probably wouldn't understand it. So, you know, they were just hiding it, and they just wouldn't send it. So then I wrote to the government about it and tried to get them to do something, and they kept referring me back. So it was a circle thing that happened. And the EPA, because it was an indoor work environment, the EPA just didn't get involved with that type of thing, which is fair. You know, their involvement was for outdoor environments. And, you know, maybe if they stood above the railway station where the vents are and monitored what's coming out of that railway station, they might, you know, put some more pressure on the government to actually try to do something about those idling diesel trains. Idling vehicles put out a lot more pollution than vehicles that are running. I see there was a question about that as well, about idling at traffic lights. And yes, it's 20. There's a study done. It's 29 times more pollution comes out of a vehicle when it's idling rather than when it's running. So, you know, that's a real issue. And can I just mention,
we're gonna have to wrap up pretty soon. We're close to time.
Just a quick one. I see a message from Bronwyn King. Was the impact on air quality considered with the recent approval of the third runway at Melbourne Airport? I've done a lot of work with that particular problem at Melbourne Airport with Maribyrnong Council, and because we found that ultrafines travel about 20 kilometres. So, you know, there is a real problem with that third runway, north-south runway. It's going to affect the western suburbs of Melbourne. So it's going to be such a problem for them. You've already got problems out there with the trains and the trucks, and now they've got a third runway on that airport. They just haven't looked at the air quality coming out of those planes. It's ultrafines that come out of those planes. So, you know, I just want to throw that out there that something's got to be done about that. But anyway.
So thanks very much, Keith. I mean, you mentioned Lydia Maraska, and we're lucky enough at the Centre for Safe Air that Lydia is one of our investigators, and I know that she's involved in a research collaboration around indoor air quality. So I think you've highlighted that indoor air quality is an issue that's going to be covered in more detail.
We have been in touch about that anyway. So yeah.
So unfortunately we're out of time, but thanks very much, Keith and Tim, for your presentations, and I'm sorry for the people who've written questions. There's a number of questions in the chat that we didn't get to, but I really appreciate everyone engaging in this discussion today. So thank you very much.
Thank you so much. Thank you, Geoff.
Thanks, Paul.
Thank you, Tim.
Thanks, Keith. Thanks, Jeff.